So we have talked on multiple occasions about the fact that it's difficult to get a family doctor. The government, of course, trying to introduce different programs. It doesn't seem to be working. In fact, there is a new study out right now that shows the proportion of Quebecers with a family doctor has dropped from 82% in 2019 to 73% a year ago in 2023. That's a 9% drop basically in the course of 4 years. Look, as bad as those numbers seem, and we know there are so many Quebecers still unable, even with whatever government efforts have been introduced to get a family doctor, the problem is there is no light at the end of the tunnel here. I'm not sure at what point we can start to say, well, something the government is doing is going to make a difference. It's not. It hasn't up until now. Dr. Dominique Hotte is a physician specialized in family medicine and on the line. Dr. Hotte, thank you for being here this afternoon.
My pleasure. Thank you.
Again, it's one thing to look at numbers and say, yeah, we know the situation has not been very good. It apparently continues, not apparently, it is getting worse according to this study. I know that the explanation or part of it here is that, this has to do with the fact that people are just deciding to retire. General practitioners are getting to that age when they're leaving. What other reasons are there here as far as you can tell?
Right. So it does feel like Groundhog Day when we read news like this. Retirement is definitely one of the big challenges. We have retirement for challenges because 25% of doctors, family doctors in Quebec are 65 or over. So that's a pretty big proportion. Also, we have other reasons why we don't have enough doctors and family doctors in the province. One of them being that the residents, so when the medical students become residents, like they train before they come into practice, a lot of them are picking specialties, like medical specialties instead of family doctors. We have every year after year after year for more than 10 years, all the positions in family medicine residency have not been filled by the residents. We have a deficit every year. So 2 years later, when they're supposed to graduate, we have a deficit. Instead, we have less than what we planned. And also, some of them who graduate, they go outside of the province, they go in the private sector. So we don't have all our graduates are not coming into the public system, and we know that's a major problem in Quebec.
So you've outlined some of the problems here, and I guess the obvious question then is, what's a solution here? I mean, how does this even begin to change?
The province of Quebec is the only place in the world, and I mean this, in the world where we have so much bureaucracy related to how the doctors, where and how the doctors can practice. Right off the bat, when you graduate as a medical resident in family medicine, you need to have an authorization from the government to work in one particular region. Once you're in practice, you also need to do certain things that are considered a priority in that region. And up until 10 years ago, doing family medicine in an office or a clinic or whatever was not even considered a priority. That just started 10 years ago. Before that, everything that was done in the hospital was a priority. And then if you had some time left, then you could follow patients in the office. So that's like a major paradigm shift right there, but it's only 10 years old. Other than that, if you once you have your patients that are we're the only province in Canada where you actually have like a name on a piece of paper for a doctor and a patient. Yeah. So we know that we have to see those patients. We know we have to register them, but it's not just about that piece of paper. It's about being actually able to deliver the care that the patients need, and that's really hard to do because we lack so many family doctors for the amount of needs that the population in Quebec has.
So, you bring up that word, and it's been brought up, of course, before about bureaucracy. And I know sometimes we tend to look at this government and think it's only making things worse. But, if you don't have a short memory, we can remember back to when Gaetan Barrette was, of course, our health minister, and again decided, it's time to reshuffle the deck here and make things better. It seems every time there's some kind of major change affected in the healthcare system, it actually only makes things worse. Am I overstating the case?
No, I think you're completely right. I think you're completely right. And again, like I said, Quebec is the only place in the world where it's like this. If you look just outside of our borders, that's not the way it is. And so I'm just kind of wondering, like, why are we, like, every government that comes in tries to have that great plan or that great idea that's going to change everything, when what we're trying to say to begin with is like remove all those barriers, remove all those steps that are discouraging the doctors to stay in practice, or the residents to come into family medicine. There's this really, really, really negative talk about family doctors, how we don't deliver year after year. There's studies that come out. There's articles like these that come out, and it's kind of discouraging because it feels like we're not doing our job as a group, when in fact what's going on is that, well, doctors don't retire like right out like that. They don't give 2 weeks advice notice and then they go into retirement. They plan years ahead. So we need to make sure that we can transfer their patients who need to be transferred to someone else. But when you're counting on new doctors to do that, they don't take like 1,000 or 2,000 patients right out coming out of med school, right? They need to adapt. They need to have a clinical experience. So it's not even planned well in that way. So that's why we're trying to move to a new paradigm shift. And that article in that Price kind of hinted at it, which is patients being registered with a group of healthcare professionals, which makes way more sense, because not everything that has to do with your healthcare problems has to go through a family doctor, like it's the case mostly right now.
So if you take that, though, as the case, right, this collective or community healthcare, if you will, I'm reading that in that same article, part of the issue with that is you get to see one doctor one day, so you have 10 or 15 minutes, and then if you have to go back, you're not assured you're going to get the same doctor. You could see somebody else in that group, which again seems to be an imperfect solution to the problem.
So it's hard to say that everyone's going to be able to see their own doctor all the time, right? So it makes sense that for one problem, they would be followed by the same person all the time. So obviously, but there could be a reason why this can't happen, obviously, like vacation or whatever, something like that. But most of the time, yes, we would like, and even us doctors would like that, because it's not fun for anyone to like have just an episode when there's a problem that needs like multiple visits. You really want to make sure that you can follow through and you get to know the patient gets to know you, and you kind of can follow your plan.
Right.
So that's what we would want. But this is not on the doctors, because those appointments they're talking about in the study, they're not given directly by the clinic. It's the government, again, decided to put an extra system there.
Yeah, they're assigned, right.
Yeah, well, they're assigned by a person that the patients have to call, who looks around in the clinics and finds a spot that's available with someone. So even there's like an extra step that's done. So it always seems to be like more complicated than what it could be, really.
I was going to ask you if you've lost hope as someone in the system. We describe all the problems, and we even with this new idea, it's, as I said, it's not perfect. It's far from it. But do you, at some point, can you understand why some doctors look around and go, you know what? It's not getting better. It's only getting worse. Ça suffit, and I've had enough.
Yeah, I hear that a lot. But this being said, I also see a lot of hope. I'm surrounded by doctors who really want to make things better. Not just doctors. Like this new system that we want to change, that we want to put in place in primary care is us family doctors working with nurses, with pharmacists, with other healthcare professionals in the same building, so when the patient comes in and has an issue, he can see the professional that's the most relevant for his problem, and everybody plays their role optimally. And so this would be a major game changer. So we're really hoping the government will get on board with us with that, because this is what needs to be done, and this is how other clinics work. If you look outside, like other clinics that are not medical clinics, you have like physiotherapist clinics, for instance. They're not just physio, they have all kinds of professional, and they refer patients to one another, and it works super well, so why can't we do that here right now? And the patient sort of has a place where he can go, and he knows that whatever happens, someone is going to see him. And yes, it would make sense that some people who are more vulnerable or have more needs would be followed by that one same person, doctor or someone else, for the whole episode. But, with time, you're going to get to know the people who work there, and everything's going to be more familiar to you, and you're going to have a safe place to go.
Which sounds like, a step in the right direction. We're going to run out of time. I want to ask you one last thing, because I haven't brought this up. I don't think you have either. We also know now, numbers released, I think about a week or two ago, showing so many, forget about people retiring, leaving the public sector to go private, and how big an issue this is.
Yeah. So it's going to be become a bigger and bigger issue if things don't change, because we're losing people. We're losing people on the ground to help us do the job, and it takes a really long time to get those doctors out of universities. So if they go straight ahead into the private sector, then we don't have ways of replacing them just like that. Because even for doctors coming out of the country, it's a long path before they can actually practice in Quebec. So this is why we need to have a paradigm shift. We can't just continue to do the same thing. It's not working, and it has been like this for, I don't know, like I've been in this in medicine for like practicing for 17 years. That's all I've known. That's really all I've known. So I just hope that for the rest of my career it's going to be different at some point, really.
I think we all do, yeah. All wish that it would be better. Dr. Hotte, thank you so much. Really appreciate it.
Thank you so much as well.
Take good care.
Bye.
Dr. Dominique Hotte, she is a family physician specialized, or family medicine. Talking about, again, just to be fair, I know it's easy to kind of look at the government and go, they've messed things up. This goes back beyond just the CAC government, right? So let's be fair.